ನಮಸ್ಕಾರ. This is Kumar Swamy, SK Kumar Swamy anta karitare. I work as a group CEO for Surakshaa Group of Hospitals. Surakshaa Group of Hospitals, I have got 3 branches. One is in MCH layout, another is in Tanisandra, and we have Ayurveda Wellness Center in Narayanpura Road. Surakshaa Hospital basically has started around 20 years back. The concept of Surakshaa Hospitals has come out on 20 years back. The same place, Dr. Swati Magari as well as Dr. Siddappa Magari, very humbly they started off a clinic here. They served the mankind for about 20 years. So 2010 to 2025, they have worked so hard day and night, and they were able to complete the philosophy of Surakshaa Group of Hospitals. Surakshaa Group of Hospitals, they have kept one kind of a thought in their mind is how best we should be able to help the mankind, how best we should be able to treat the patients with a very affording price. Money is not been kept as a prime motto as far as Surakshaa Group of Hospitals. They always treated the patient with care, kindness and compassion. And whatever the money is there, it has come as a bonus for them. It is the popularity they have gained over a period of 20 years. They were able to structure 3 good hospitals and with all the world-class operation theatre, ICUs and all the facilities they have in their hospitals. Now, Surakshaa Hospital, with the leadership of Dr. Siddappa Magari as well as Dr. Swati Magari as a co-directors, they wanted to have a one-step leap to upscale their services to the mankind. They are introducing a very rare concept of treatment of varicose vein without surgery. There are concept that surgery and vascular surgery is meant for varicose vein. That is the concept very people have got it. But the concept which we have brought in here is a non-surgical treatment for varicose vein. I am sure this is going to help lot of people who are suffering with varicose vein. Of late, there are many people who are suffering with varicose vein because of their habitats, like they stand and work and they don't take care of themselves and all that. Varicose vein prevalence has been very high, so there is a great opportunity for the people to get treated with varicose vein. So non-surgically, how best the varicose vein can be treated is being the concept of Surakshaa Group of Hospitals. I think we have discussed more about the concept of Surakshaa Hospital and why the varicose vein clinic has been proposed and all that. Having said all this, I would like to introduce with lot of prideness Dr. Muniraju Marlakunte. He has been an expert in non-surgical intervention for varicose vein, and I request him to explain the benefits of non-surgical way of varicose vein treatment. I am going to ask him the questions and he is going to answer for the benefit of all of you. I think it's going to be a very good session. I think people have to glue yourself to a seat and just keep watching.
Thank you so much for inviting me on this occasion. I am Dr. Muniraju Marlakunte. I am a radiologist and expert in management of varicose veins. I did my MD from Postgraduate Institute of Medical Sciences, which is a renowned premier medical education institute in India, and I am also have done administrative course in BITS Pilani. Today we will be talking about varicose veins and its management.
Doctor, having talked about varicose vein and its non-surgical way of treatment and all that, I definitely like to ask you the first question. What are the varicose vein and what is chronic venous insufficiency? And there are a lot of people who talk about spider veins. So is there any difference between that, or how do you explain it to the people, doctor?
To understand it simply, varicose veins are nothing but just the dilated superficial surface veins in the legs. It can happen in upper limb also, that is in hands, but it's more commonly seen in legs, and I will tell you why it happens more commonly in legs. And it arises due to deficiency of the valvular function. Like our heart, even veins in the legs have got valves. When they become floppy or weakened, the vein will go for dilatation, that is swelling. So you would have observed a few changes in legs, like some snaky kind of venous engorgement or enlargement in the legs. That is exactly varicose veins. When it comes to chronic venous insufficiency condition, it is just because of this dilatation, there will be lot of pooling of blood within the venous system in the legs, which ideally the blood within the veins has to pump to the heart. It is deoxygenated blood, so it has to get oxygenated and it has to get supplied to other organs of the body. But here, because of valvular weakness, the blood gets pooled within the veins, and after that the subsequent changes will develop. We call it like an inflammation, or sometimes we can call it like a just injury, and which can cause us chronic aching and skin color changes. All these things are related to chronic venous insufficiency. And a very mild or aesthetic or some cosmetic problem called a spider nevus, like how you see a spider with a tiny central body and which has got lot of limbs around. Such a reticular venous changes will be observed on legs, that is called as reticular spinous.
What are the early signs and symptoms of varicose vein, doctor?
Usually the early symptoms are dilated veins, especially the people who are into who are into habit of wearing this small outfits. They are very much bothered about the swellings. That is one of the signs. Another thing is that they will get a kind of discomfort, a crampy pain in their calf region, aches in the calf region. Sometimes ulceration develop or wounds develop in the leg. Sometimes the wounds will go for bleeding. These are all, infection may happen. These are all the things which are symptoms and signs of varicose veins. And when the symptoms of limb swelling, wound ulcer develops or bleeding develops, they must get treated.
What are the risk factors of varicose vein?
Third question. Risk factors, it varies. Most commonly we call it like a genetic predisposition will be there, and the height also matters. If someone is very tall, they are predisposed for this condition. Sometimes even pregnancy related issues, when a mother will be having a fetus in a womb, at the time there will be compression of the veins in the pelvis, which stops the easy flow of blood from the legs to the heart. Here also the things will go for the veins will go for dilatation. Hormonal changes may also cause dilatation, and which results in varicose veins. People who are FT or obese people, they also have issues with abdominal pressure. They can also go for varicose veins development. And very rarely I have seen that some patient with heart disease, for prolonged chronic long-standing heart disease, can also cause increased venous pressure, and varicose veins will develop in them. So these are the factors, risk factors for the development of varicose veins.
Third question. And could you mind helping us? What is the diagnosis? How do we diagnose, and what is the diagnosing methodology as far as varicose vein is concerned?
Diagnosis, as the expert can just pick it up when we look at the legs. Sometimes even patients will themselves will come up with the symptoms. They will be showing us the dilated varicose veins. But here, to take the decisions whether to treat or not, we have to do a further investigation, and that is the gold standard investigation for this is ultrasound Doppler examination. We do Doppler scan on their legs, and we will be checking for the incompetent valves, that is floppy valves or non-functional valves, and we will be checking for regurgitant. I mean the backflow of the blood into the varicose veins, which is the which will be which are the things to be treated. So duplex scan is the best modality of investigation to diagnose this condition, and sometimes we may require the help of CT angiography or MR venography for that. Sometimes we may require the help of CT venography or MR venography for diagnosis of varicose veins.
Fifth question. Doctor, in varicose vein, what are the treatment options?
Right. See, classically we are shifting from surgery to non-invasive or minimally invasive therapies for this. Initially there was something called as stripping and ligation. It was an open surgery. Now we don't do that. It is like becoming obsolete. Now the whole world, the global level shift is happening towards minimal interventions like radiofrequency ablation or laser ablation techniques, where we will be inserting a small catheter mounted with a radiofrequency ablator antenna or laser antenna, and because of heat there will be coagulation and there will be obliteration of these varicose veins. So most commonly we do ablation therapies. There is something called as vena seal, where we inject the glue into dilated varicose veins and we cause occlusion of the varicose veins.
Doctor, I would like to ask you a question. What is sclerotherapy as well as hybrid techniques?
I am glad that you opened up this topic. Sclerotherapy, where we inject a small chemical called as STS into the veins, and it is not suited for long course of veins. Whenever there is a cluster of non-specific veins are dilated, or once the therapy with laser ablation has done and there is a recurrence of small veins at places, then we go for venosclerotherapy. When we use venosclerotherapy with laser or with radiofrequency ablation, that is called as hybrid technique. So basically we should understand that whenever there is a small cluster of veins are dilated, then we can treat it with venosclerotherapy.
Doctor, I like to ask you seventh question. See, varicose vein treatment and non-surgical way of treatment, you have been an expert in that. I also like to ask you a question, how safe it is and what is the risk factors and what are the complications out of it?
When it comes to effectiveness with radiofrequency ablation and laser ablation, the effective rate is 98 to 99%. We are damn sure that the vein will go for collapse, but the thing, patient has to follow certain instructions, like they have to wear compression bandage, and there should not be any accessory veins in their body. If there are accessory veins, then it will recur. Then again, it is not a tough job to treat it. We can treat once the recurrence is known. And sometimes it is a myth that 100% cure will happen with laser or ablation. If someone is promising that, probably they are not an expert in this, or it is a fake thing. So one has to understand that there is a chance of recurrence.
Doctor, I would like to ask you, after the treatment, post varicose vein treatment from you, what is the recovery and follow-up which is necessary from the patient side? Do they like to come again and again, and what is the recovery and follow-up? Would you mind explaining to the audience, doctor?
Ninth question. Recovery is very simple. As soon as I finished laser ablation or radiofrequency ablation, I make sure that patient walks immediately for 20 to 30 minutes to prevent formation of deep venous thrombosis. Now you can imagine that we have done a ablation of varicose veins. The patient is not being immobile for 1 or 2 days. Immediately I make them to walk. I encourage them to visit their office next day itself. If they don't want to go to office, at least I call to my office to check whether DVT has formed or not. Really nice. So it does not require any kind of admission or prolonged stay in hospital. That's the advantage of our laser therapy.
Okay, the last question. Doctor, I'm extremely happy. I think you have been answering very well. I think we have been getting a good enlightenment as far as the varicose vein concerned, because there was a lot of myths and there were a lot of facts. But your explanation on the questions, whatever has been asked, was very, very interesting. I thank you for that. And the last question I would like to ask you is, how do varicose vein be prevented, and what is the lifestyle which people have to take care so that they are not encountering into the varicose vein? What do you say for all these people?
I am really glad that you opened up this topic. Yes, it's very relevant in current generation people who are more glued into social media use. But what I want to tell them is that, all these recipes are there to consume, not to apply on the skin. Skin is not going to absorb or do anything to that. So in fact, it can be harmful if it is an advanced varicose veins disease, because already there will be pigmentation formation in varicose veins due to prolonged blood pooling there, and blood products will get accumulated in the skin, and they are kind of irritant. Upon that, if you apply any kind of irritants there, it is going to worsen the condition. It is going to accelerate the formation of ulcers. Bleeding risk will increase, infection rates will increase. So I request all my audience or the people who are listening to this program not to go for application of any recipes or any kind of lemon juice, orange juice, or any kind of turmeric or something like that on the leg. It's better to go and get early treatment done for the varicose veins. If at all people are concerned about prevention or prevention of early prevention or prevention of recurrence, what they can do is that they can go for an ankle strengthening things. They can go for certain yoga where we have to massage in such a way that the whatever the blood collected in the venous system will be drained back to the heart, and wearing compression bandages will help them a lot.
Doctor, having spent a lot of time, I think it was very amazing session as far as I am concerned. I think I must be ever thankful to you for this particular session. I think not only me, everybody who is looking at this particular program have been very well educated on the varicose vein, and especially the non-surgical way of getting the varicose vein treatment was simply amazing. I think I thank you millions for this particular thing, and being very busy practitioner, I think you have spared a lot of time to come and talk to us and talk to the people. I am extremely grateful to you. Thank you so much.